So good afternoon, ma'am. My name is Aina and today I will be performing the assessment on the abdomen. So first is I have my equipments. I have a alcohol for hand hygiene, and stethoscope for auscultation, and a tape measure for measurement. Then I will now greet my client. Good afternoon, ma'am. My name is Aina student nurse from Misamis University, and may I know your name, ma'am, your age, and your birth date?
My name is Abdomen. I am 25. My birthday is January 1999.
So ma'am, the purpose of this assessment is to detect for any abnormalities in your abdominal area. So ma'am, before natin start the procedure, ma'am, kayo na ma'am? Okay, so I have already provided the client's privacy. Now ma'am, pwede niyo mo kubuo ng imong t-shirt ma'am? Or expose ang imong abdominal area ma'am? Okay, so now, inyo paan lain na supine position. So, before starting the procedure, I will perform a hand hygiene. Then I will expose the client's abdominal area, which is already exposed. So first is observe the coloration of the skin.
So the normal findings, abdominal skin may be paler than general skin tone because this skin is so seldom exposed to the natural elements. The abnormal findings is purple discoloration at the flanks indicates bleeding within the abdominal wall. Redness may indicate inflammation, bruises, or areas of local discoloration.
And next is note the vascularity of the abdominal skin.
Normal findings, scattered fine veins may be visible. The abnormal findings is dilated surface arterioles and capillaries with a central star may be seen with liver disease or ascites.
And next is note any stretch marks due to past stretching of the reticular skin layer.
New striae are pink or bluish in color. Old striae are silver, white, linear, and uneven stretch mark from past pregnancy or weight gain. The abnormal findings is dark blush pink striae are associated with Cushing syndrome.
Next is inspect for scars.
The normal findings is pale, smooth, minimal, raised old scar may be seen. The abnormal findings is non-healing wounds, redness, inflammation, deep irregular scar may result from burns.
Next is assess for lesions and rashes.
The normal findings is abdomen is free of lesions or rashes, flat or raised brown moles are normal. The abnormal findings is change in mole including size, color, and boundary symmetry.
And next is also inspect the umbilicus.
The normal findings is umbilical skin tones are similar to surrounding abnormal skin tones or even pinkish. The abnormal findings is a deviated umbilicus may be caused by pressure from a mass, enlarged organs, hernia, fluid, or scar tissue.
Next is inspect abdominal contour by sitting at the client's side and look across the abdomen at levels slightly higher than the client's abdomen.
So the normal findings is abdomen is flat, rounded, or scyphoid, evenly rounded. The abnormal findings is a general protuberant or distended abdomen.
Okay, next is assess abdominal symmetry.
The normal findings is the client's abdominal is symmetric. The abnormal findings is asymmetric may be seen with organ enlargement, large masses, hernia, dystisis, retic, or bowel obstruction.
And next is inspect abdominal movement when the client breathes.
The normal findings is abdominal respiration movement may be seen especially in male clients. The abnormal findings is diminished abdominal respiration or charge to thoracic breathing in male clients may reflect peritoneal irritation.
Next is observed aortic pulsations.
The normal findings is a slight pulsation of the abdominal aorta in the epigastrium. The abnormal findings is vigorous white exaggerated pulsation may be seen with abdominal aortic aneurysm.
Next is observed peristaltic waves.
The normal findings is normally peristaltic waves are not seen. The abnormal findings is peristaltic waves are increased and progress in a ripple-like fashion from the lower upper quadrant to the right lower quadrant with intestinal obstruction.
Then I will proceed for the auscultation. So first is I'm gonna warm the diaphragm of the stethoscope by rubbing it against my palm. Next is place it beginning in the right lower quadrant and proceed clockwise covering all quadrants. And listen for at least 1 minute every quadrant and note the intensity, pitch, and frequency of the sounds. So, ako lang yung ausculted ng mga abdominal area, mga pair, mga
A series of intermittent soft click and gurgles are heard at a rate of 5 to 30 minutes. Hyperactive vowel sound refers to as borborygmus may be heard, and that is normal. The abnormal findings is hyperactive vowel sounds that are rushing, tingling, and high pitch may be abnormal, indicating very rapid motility heard in early bowel obstruction, gastroenteritis, diarrhea, or laxatives.
So next is I'm going to auscultate for vascular sounds over the abdominal aorta, over the renal iliac artery, and the femoral artery.
Normally, bruits are not heard over the abdominal aorta or renal, iliac, or femoral arteries. The abnormal finding is bruit may indicate an aneurysm or renal arterial stenosis.
Next is listen for venous hum using the bell of the stethoscope in the epigastric and umbilical areas.
Normally, venous hum is not heard over the epigastric and umbilical areas. The abnormal findings is accentuated venous hum heard in the epigastric or umbilical area suggests increased collateral circulation as seen in crisosis of the liver.
Next is auscultate for friction rub over the liver and spleen. Lessen over the right and left rib cage with the diaphragm of the stethoscope. So I will be using the stethoscope.
No friction rub over liver or spleen is present and that is normal. The abnormal findings is a rub heard at the anterior axillary line in the lower left costal area is associated with splenic infraction, abscess, infection, or tumor.
So now I will be proceeding for the percussion. First is I will percuss lightly and systematically all quadrants clockwise or up and down over the abdomen. Ay ma'am, pili ko muna kami mga percussion.
So normally, generalized tympani predominated over the abdomen. Dullness is heard over the liver and spleen. The abnormal findings is an enlarged area of dullness is heard over an enlarged liver or spleen.
So next is I'm going to percuss the span or height of the liver by determining its lower and upper borders. And measure the distance between the two marks. This is the span of the liver. So since kaning part sa assessment is kinahanglan ma-expose ang breast sa patient, and my patient is female, so daily lang na po ni i-perform. Then ako lang i-istorya ang mga findings.
So the normal findings is the lower border of liver dullness is located at the costal margin to 1 to 2 cm below. The upper border of liver dullness is located between the 5th and 7th intercostal space. The abnormal findings is the lower border of the liver dullness may be difficult to estimate when obscured by intestinal gas. The upper border of liver dullness may be difficult to estimate if obscured by pleural fluid or lung consolidation.
So next is percuss the spleen.
The spleen is an oval area of dullness approximately 7 cm wide near the 10th rib. The abnormal finding is splenomegaly is characterized by an area of dullness greater than 7 cm wide. The enlargement may result from traumatic injury or portal hypertension.
Next is I'm going to perform a blunt percussion on the patient's liver. Ma'am, yun ako sakit, ma'am. Ha? Sakit, ma'am.
Hindi.
Normally, no tenderness is elicited. The abnormal finding is tenderness elicited over the liver may associate with inflammation or infection.
Next is I'm gonna perform a blunt percussion on the kidneys at the costal vertebral angles over the 12th rib. Sakit, ma'am. Sakit, ma'am.
Normally, no tenderness or pain is elicited or reported. The abnormal findings is tenderness or sharp pain elicited over the costal vertebral angles, suggest kidney, renal calculi, or hydronephrosis.
So now I will be doing the palpation. So first is perform light palpation to identify areas of tenderness and muscular resistance. Using the fingertips, begin palpation in a non-tender quadrant in a dipping motion. Then gently lift the fingers and move to the next area. So, ma'am, hindi ka po sa mga abdomen, ma'am. Kaya ma'am. Sakit, ma'am. Ano, ma'am? Ano, ma'am? Sakit siya? Bilis, sakit.
Normally, abdomen is no tender and soft. There is no guarding. The abnormal findings is involuntary reflex guarding may reflect peritoneal irritation. The abdomen is rigid and rectus muscle fail to relax with palpation when the client exhales.
Next is deeply palpate all quadrants to delineate abdominal organs and detect subtle masses. Okay. So, sakit ma'am. Ano ma'am? Ano? Ano ma'am?
Normally, mild tenderness is possible over the xiphoid aorta, cecum, sigmoid, colon, and ovaries with deep palpation. The abnormal findings is severe tenderness or pain may be related to trauma, peritonitis, infection, and tumors.
And while palpating the all quadrants, I have also palpated for masses, and normally there are no palpable masses. And see,
The abnormal findings is a mass detected in a quadrant may be due to tumor, enlarged organ, or cyst.
next is I'm going to palpate the umbilicus and surrounding areas for swelling, bulges, or masses.
Umbilicus and surrounding area are free of swelling, bulges, or masses, and that is normal. The abnormal findings is a subcenter of the umbilicus can be a potential for herniation.
Next is palpate the aorta by using the thumb and first fingers or two hands and palpate deeply in the epigastrium.
The normal findings is the aorta is 2.5 to 3 cm wide with a moderate, strong, and regular pulse. A wide bulging pulse may be felt with abdominal aortic aneurysm, and that is abnormal.
Next is I'm going to palpate the liver and note consistency and tenderness. Sakit ma'am. Sakit ma'am.
The liver is usually not palpable. If the lower edge is felt, it should be firm, smooth, and even, and that is normal. The abnormal findings is a hard, firm liver may indicate cancer. Nodularity may occur with tumors, metastatic cancer, and late cirrhosis.
Next is palpate the spleen and stand at the client's right side and reach over the abdomen.
So the normal findings is the spleen is seldom palpable at the left costal margin. The abnormal findings is a palpable spleen suggests enlargement up to 3 times the normal size, which result from infection, cancer, or trauma.
Next is palpate the kidneys.
Normally, the kidney are usually not palpable. If palpable, it should be firm, smooth, and grounded. The abnormal findings an enlarged kidney may be due to tumor, cyst, or hydronephrosis.
Next is to palpate the left kidney in the reverse procedure. So next is palpate the urinary bladder.
So, an empty bladder is neither palpable nor tender, and that is normal. The abnormal findings of distended bladder is palpated as a smooth, round, and somewhat firm mass extended as far as the umbilicus.
Then, after that, assess the client to a comfortable position. Then, I will perform hand hygiene. Then, documentation and refer